Oh, undoubtedly a powerhouse of a voice. Even Adele can be sidelined with back pain. The singer says she recently collapsed backstage during her Las Vegas residency because of a sciatica attack. And she says she wasn't even able to move. The singer has gotten very candid recently about her health issues, specifically her spine. She's been dealing with back pain since she was 15 years old and has been in pain for half of her life. What exactly is sciatica pain? What can be done about it? Well, let's find out. Dr. Balaguru Ravi with Kelsey-Seybold Clinic joins us to help us out with this that affects so many people. Good morning to you.
Good morning.
I think we've probably all heard that term sciatica. What does it mean and how does it affect us?
Yeah, it's a very common term. We see it a lot in clinics. It's really a term that to basically describe the shooting pain down the sciatic nerve, usually in the back of the thigh all the way down to the leg in certain cases.
It can really be debilitating,
Correct.
can it?
It can, yes.
It's so painful. So what can somebody do about it?
Prevention is key if you can get away with it. I would do basic daily stretches every day. Try to make sure the ergonomics, if you're having a desk job, making sure the computer and the keyboard are all in alignment with how you're sitting down. But morning stretches every day, even when you're going to bed, can help minimize the risk of it occurring.
So it might be something that you just want to look up. What are, popular back stretches if you don't know how to stretch your back, right?
Correct. That's correct. More common ones that I usually recommend are touching your toes with your hands when you're standing in the morning, doing a sunrise stretch, pushing your hands out, can help kind of stretch out the muscles in your lower back.
And as we hear from someone like Adele, who's been suffering from spinal problems her whole life, do you see that this sort of runs in families? I mean, it just makes you wonder, why would somebody so young have to deal with something like this? Or could it be from an injury? I mean, obviously we don't know her situation, but I'm just in people in general.
Yeah, so the more common reasons, it's either coming from the spine or outside the spine. If it's coming from the spine, you really want to look at disc herniations in that lower region or sometimes pinching on the nerve. If it's outside the spine, usually there are common causes like a hamstring strain, pregnancy, being overweight or in the obese category can put you at higher risk.
When is it time to go to either a doctor, chiropractor, whoever you suggest that they go to get some type of imaging to see what's happening inside of there to make sure they're treated correctly?
Yeah, so up front, I wouldn't recommend imaging unless the pain has been going on for at least 6 weeks.
Okay.
But red flag symptoms are what we're really looking for. What are red flag symptoms? I would say things where you're losing the ability to urinate, go to the bathroom on your own control. If you have shooting pain down both legs, those are also really concerning features. If the pain is really detrimental to you and you can't even do the things you like to do daily, or if it's affecting your ability to even sleep at night, those are really the key red flags that we look at, and that's the time to come see the physician.
Just to go back on what you said, so you said it's very concerning with both legs. So this is typically just something that would affect one or the other?
More commonly, it should affect only one side of the leg. But if it's happening on both sides, it's telling me it's more of a red flag alert. It could be coming from the spine. It could be a disc problem, a tumor, or a cyst in the spine. That's something we have to rule out.
So you definitely need to get to a doctor if you're having that.
Exactly.
Now, is it fairly easy to diagnose this? Because it seems like these particular symptoms are pretty cut and dry with what's going on there.
Yeah, it's a clinical diagnosis at the end of the day, and there's certain physical exam maneuvers that we can perform in the office setting to help clue in onto that. But if the pain continues to persist, that's where imaging can play a role. So usually there are some physical exam maneuvers that we can start to clue in and then go from there.
Now, do you have suggestions for when people are lying down, when they sleep, ideas to how to make sure that spine's straight, or what do you suggest for people who are suffering from this?
Yeah, so like I said before, trying to stretch before you go to bed, taking an evening shower, putting some warm water on that area, even using a heating pad, things to do to help minimize the risk of it stiffening up when you're laying flat on your back. If it's really bothering you, trying to turn on your side to try to minimize the stiffness when you wake up in the morning is a really good idea.
Whatever it takes. And I have seen all kinds of funny things like get a tennis ball and rub it, or do any of those things help?
Massage is okay. I'd say if it helps you out, massage out the lower back, try to work out those muscles, even your hamstrings, doing some hamstring stretches, things like that will help minimize risk. But yes, I'm okay if it helps the patient, it's okay to do.
I tell you what, if you're in sciatica pain, you'll do anything to relieve it. So maybe whatever you find that works for you. Thanks for taking time from Kelsey-Seybold Clinic, again, affecting so many people. Hopefully people can get some relief real soon, not have to suffer like poor Adele does.